You're listening to the Wilmac Wire, the podcast that's designed to give you a glimpse into a growing SaaS company, specifically in the realm of customer interaction technology. From customer experience to data management, we'll talk about it here. Thank you for tuning in. Good morning, good afternoon, good evening. Hello and welcome to this episode of the Wilmac Wire. Thank you for joining us. We're excited to utilize this episode as a preview of an upcoming live in-person event that will actually be going on exactly a week after the release of this specific episode. And the event is a panel discussion titled Digital Health in the Contact Center, an opportunity to advance health equity. In today's episode, we're thrilled to be interviewing one of our panelists, Dr. Thomas Green of Jordan Health, as a preview for the event. Now, Wilmac's CCaaS director, Barbara Stevens, will be interviewing Dr. Green for today's episode, but before I hand it over to them, I just want to give a brief overview of what you can expect. So the first part of the conversation is going to revolve around learning more about Dr. Green and his evolution as a professional. And we're going to talk a little bit more about his role at Jordan Health and the challenges that he faces so you can get to know him and what he does every day better. The second half of the episode will then touch on the upcoming event, and Barbara will actually be asking him one of the panel questions that we have planned for next week on October 24th for our event. Now, Barbara and Dr. Green, thank you for being a part of today's episode, and I will hand it over to you.
Thank you, Emily, and thank you, Dr. Green. We appreciate your time today. And we're very excited that you're going to be participating in our event next week. And can you do me a favor and just tell me a little bit more about yourself, about who you are and what is it that you do at the Anthony Jordan Health Center?
Yeah, well, hello, and thank you for this opportunity to engage with your audience. And that's a very loaded question, who I am, and I've thought about it a little bit in terms of how do I give you enough flavor without, going over time on this. But I am a native Rochesterian. I still live in the city of Rochester. I've done most of my formal education around Rochester, New York, and I'm a graduate of the Rochester City School District. I was a patient of the first African-American doctor in Rochester, New York, Dr. Charles T. Lunsford. I work at a healthcare center named after the second African-American doctor, which is Dr. Anthony Jordan. And so it's been a privilege for me to look from many angles of where I've gotten to where I've gotten today. But today I serve as the Chief Equity and Engagement Officer at Jordan Health Center.
Excellent. So how did you get to your current position? What made you interested in health equity?
Well, I got here, I want to say by happenstance, but I believe in the words in the Bible. It says, trust in the Lord with all your heart and lean not to your own understanding, but in all your ways acknowledge him and he will direct your path. So I'm going to say the Lord has led me to where I am today. The journey in terms of work and education started, obviously, as I said, in high school, and moved to me achieving my bachelor's degree in computer science from SUNY Brockport to receiving my master's in strategic leadership from Roberts Wesleyan and achieving my doctorate in education from St. John Fisher College, all here in the greater Rochester area. And from a job perspective, I started out in IT with the city of Rochester, becoming the head of IT for the city of Rochester, and eventually moving into community action with the organization here, still head of IT. And then I got a call from the CEO here at Jordan Health during that time and said, hey, would you like to come over and work with us? So I ended up coming to Jordan Health at that time to be the head of IT, and then eventually moving into being the chief operating officer. And I ended up writing my dissertation during my doctoral program called We're All in This Together, examining the lived experiences of community leaders working to address health disparities. And so now I find myself with the opportunity now to take that one step forward as the Chief Equity and Engagement Officer to make sure that there's health equality for all.
That's wonderful. Thank you. So what is the most favorite thing about your role right now that you have, Dr. Green?
Well, this is a different type of role that I just kind of got into about a month or so ago. But the thing that I do, I've appreciated being in IT. I've appreciated being the chief operating officer and being in a VP role in other organizations. But those roles all really called for me to do internal work, to put out fires on the inside, to try and be strategic and trying to move the organization forward in that way. In my new role, I get to advocate more on a governmental level. I get to advocate within the community and to try to achieve equity by working directly with those in the community. And so for me, it's a great win. A little bit less stress over the day-to-day operations of 24/7, making sure that there are no issues. And in this case, I'm still looking to work 24/7, but in a different capacity to make sure that there's equity in our community and everybody has access to healthcare.
Yes. What is the most challenging aspect of your job when trying to achieve equitable outcomes?
Well, I think systems, structures can be difficult. Change can be difficult for us. I think what has exacerbated us a little bit in terms of that is COVID. And so we know that as many of us have been affected by COVID in some ways, it brought the strength of community organizations together, but at the same time, it caused issues and a consciousness for others who are trying to live a self-sufficient life. And all of those social determinants of health that were there became a challenge for the individuals as well as the organizations that were trying to support them. So that's what I've found during this season.
Thank you. So now we're going to move to the second half of this, and we're going to speak about the upcoming event. Why did you agree to participate in the upcoming event on October 24th?
Well, I think one thing that jumps out at me is the fact that I have lived my life in the digital age, if you will, being that I had a bachelor's degree in computer science, that I've been the head of IT for a large governmental organization, and the fact that IT has always been within the structure of my career. And now I have moved a couple of years ago into the healthcare arena. And with that, and with some of the educational background, I think that this is an opportunity for me to participate and at least share my views and my thoughts, my lived experience, as you will, as it relates to both digital and technology, and with the human side of health equity.
Thank you. Yeah, and perhaps it's your background in IT that is making you eager to have this conversation, because I found that the conversation about technology and health equity seems to be siloed in our community. And hopefully this event will help to de-silo those two areas. So how does Jordan Health use, and if you don't currently feel you use technology to achieve equitable outcomes, that's okay. But if you do, how do you use technology to ensure that all patients, regardless of their background, feel that they can remain healthy and out of the health system?
Sure. I think that there's a lot of quality of health initiatives that we have and things that we look at as Jordan Health or even just community health organizations do. I just came back last week from the Community Health Association meeting up in Saratoga, and I was really thrilled and encouraged by the fact that everyone is looking to do more, and sometimes we're trying to do more with less. And so I think from a Jordan Health perspective, we've had some things in place, and we're looking at moving in a direction to make more equitable things available through the use of technology. So language translation services is one of the things that jumps out at me that we've had for years. So when you think about people coming in and not speaking English or English isn't their first language, we've been using those language translation services for quite some time for people to be able to walk up, for us to be able to give translation or even translation over the phone. We do that translation also with the documentation that we're presenting to patients. So those are one of the stronger pieces that I think we've done. We've made patient portal available, our Hilo portal available to patients as need to, so they have access to the information. We have a messaging system within our electronic medical record system where we can actually communicate with patients. We have online scheduling. So you can go to our website, you can schedule appointments online. But those are just the start of a lot of things that we have to come that we're going to be leveraging technology with to help us to better serve our patients.
That's wonderful. And you mentioned doing more with less. So it actually makes me think about the New York State 1115 waiver, and how that can come into play to help perhaps expand your technology to help encourage health equity. So that's a whole nother conversation. And you mentioned, meeting the needs of, multiple languages and the diversity of that population. And so we're going to be addressing that next week. So we'll be looking forward to expanding on that conversation. So I just have one more question for you today. And that question is, how can healthcare leaders drive change in technology adoption to better support patient care and equity?
Yeah, so that's a great question. You mentioned 1115 waiver. That's an opportunity outside of what the normal CMS supported programs are. Jordan Health happens to be an Article 28 HRSA funded organization that helps us to be able to also be able to have some funding to help leverage for marginalized communities. But we can't do it alone. We can't do it with minimized funding. I just mentioned I was at the association meeting, and we were talking about one of the demonstrations was given on AI. This organization was using a chatbot to be able to better communicate with their patients. We've done a similar thing with texting with some of our patients through one of the organizations we work with. But those are the type of advancements, those are the type of technology that we need to make sure that we can leverage. And we can only leverage that when the funding is made available. Now, one of the things I'll say about this particular organization, when they were using the chatbot with AI, they brought to our attention that they had a pretty successful project. But when the funding was gone, the difficult became trying to show the ROI to an extent that they could self-fund it. And there are some technology advances that you can, or some changes that you can make, but in other projects, it's just not possible with the cost of what the technology is. So those are opportunities. We need to make sure that we're able to find funding that not only allows us to do a project, but to get our return on the investment in terms of being able to show how this can help us to level the field in terms of equity in order to be a better service provider for our population and our patients.
Agreed. And we're going to definitely dive deeper in next week on the 24th with additional panelists. So it's definitely going to be a very interesting conversation. Mm-hmm. So thank you. And now I'll turn it back over to Emily.
All right. I don't know about you guys, but that made me like super excited for the actual event on the 24th. Dr. Green, thank you for sharing more about you and your role. It's really interesting. I love hearing about the history and evolution of people's careers and how you get to where you are today. And then I know that last question was actually one of the panel questions that we'll be asking next week. So thank you for sharing on that. I'm really looking forward to hearing, like you said, Barbara, the other panelists' input and just really diving deeper into those subjects. So, and Barbara, I got to shout you out with the interview. You're going to nail being a moderator next week. Like I said, this just made me so much more excited for it. So before I wrap up and close out the episode, though, I just want to add a few more logistics around what people can expect and what our listeners can expect from the panel discussion next week. So formally, that is going to be Thursday, October 24th at the 5-Star Bank Building in downtown Rochester. Doors are going to open at 10:30 a.m. Parking will be provided, all that sort of stuff, as long as you register. But 10:30 a.m., doors open. We'll have networking and some light refreshments. 11 a.m., the panel discussion will formally start, and that'll go till 12. And then we'll be having an optional workshop afterwards from 12 to 1. So just to shout out our panelists, obviously we have the one and only Dr. Thomas Green, who joined us today from Jordan Health. We have Dr. Lonnie Haynes from Rochester Regional Health, Ronnie James Meyer from our CCaaS technology partner 5-9, and then Christina Cavallari, who is one of our representatives from Wilmac that you might have heard on a previous episode. So we're excited to have a great bunch up on the stage next Thursday. So like I mentioned as well with the digital health workshop, we're actually providing all our registrants a digital health assessment prior, which is designed to give you an idea of how your current technology infrastructure measures up to advancing your health equity initiative. So that's going to give you a formal score that then during the workshop, you have the opportunity to come upstairs and like have a one-to-one conversation about that score, almost a consultation, if you will. So if you haven't registered yet, if we've proven to you that it's worth your time, and I promise you it is, you can find the link to register in the episode notes. So again, thank you, Dr. Green and Barbara, for joining us on this episode of the Wilmac Wire. And you'll be hearing from us in a few weeks when we air the actual event on the podcast. So thank you both, and thank you to our listeners.
Thank you, Dr. Green. Thank you, Emily.
Thank you.
Thank you for joining us for another episode of the Wilmac Wire. Make sure you never miss an episode by subscribing on your favorite podcast platform or visiting our website at www.wilmactech.com. You can also watch the full video recordings of every episode on our YouTube channel. Thank you for being a part of our community, and again, thank you for listening to the Wilmac Wire.